Hey, everybody, welcome to our very important segment all about this. Did you know that NCLEX is changing? This is the hottest topic right now when it comes to getting your license in nursing. NCLEX is changing, and so you have to be ready to pass the exam now or be ready for these changes. And I'm going to tell you about the changes every week during Remar Nurse University. So, as you know, when it comes to the NCLEX exam, it changes every 3 years. And typically, the changes are very minor, little bit of presentation changes, the scoring logic changes may increase, things like that. However, next year, the changes are major. Let's look at the current NCLEX exam before it changes. What do we know about NCLEX right now? The purpose of the exam, it was developed in order to determine if an entry-level nurse is equipped with skills and abilities that meet the client's healthcare needs. So that's perfect. That is what the license exam is supposed to do. Keep the public safe. So the current test structure has these elements, and we know them and we love them. So the first element is the exam is computer adaptive. So that means everybody's test is different and it's individualized by the person. You actually choose the exam that you are going to take. Well, how about how many questions you can get? You can get between 75 to 145 test items on your current exam. And 15 of these items don't count. Now, the thing is, we don't know what items are considered pre-test and what items are considered the for real test because they're all mixed in. And the way that we can get questions vary. We can get multiple choice, multiple response, which is select all that apply, drag and drop, hotspot. We can get some audio questions. There can be some graphics and exhibits currently on the exam. This is a pretty long test. You get 5 hours to complete your exam. And the scoring is straightforward. Either you get these questions right or you get them incorrect. There is no partial credit. So this all seems pretty sophisticated. A lot of students ask me all the time, why is the NCLEX changing? What are the reasons that these major changes are going to happen? And it is simply based on research, just like everything else that we do in nursing. It has been found that 50%, which is half of new nurses, make errors. All right. And the thing about it is 65% of the errors that new nurses make are related to some form of poor judgment, specifically clinical judgment, either a task or an environment. Then the nurses, they just did not know what to do or what a situation called for. And even more importantly, people knew. People knew. 20% of employers believe that they received new nurses who were not prepared to make clinical decisions. And some of us can really think back to when we first came out of nursing school. Did we really feel prepared for all that we had to do as a new nurse? So the goal of the exam was to now develop test questions or test items that actually mimic real life practice of nursing. And so we are going to be seeing a new way to determine what a student knows. And so that is introducing the next generation NCLEX. And every week I will be talking more and more about this NGN NCLEX exam. So before I leave, I do want to look at a sample question type that we will see next year starting in April of 2023. So again, guys, like I said earlier, you need to be prepared now. Seriously, this is it. Pass the NCLEX now, or be ready for these changes. Be ready for these changes because it is all going down April 2023. Here's an example of a next generation NCLEX practice question. Reginald has undergone a kidney transplant. What assessment findings would prompt Nurse Caitlin to suspect organ rejection? Select all that apply. Number 1, increased blood pressure. 2, shock. 3, fever. 4, swelling extremities. 5, decreased urine output. 6, polyuria. 7, rapid weight gain. 8, rapid weight loss. What say if you guys, we are talking about a client who has undergone a kidney transplant, what assessment findings would indicate organ rejection? And so this is a next generation question type. So you have here more choices. Actually, we could have up to 10 item options that we would have to select from. So if you have done this question appropriately, you would have chosen increased blood pressure. You would have chosen as well swelling extremities. 5, decreased urine output. And 7, rapid weight gain. Those were the correct items. When a person receives a kidney transplant, the immune system sees it as foreign and attempts to reject it. Hypertension, elevated body temperature, swelling hands and feet, decreased urine output, and rapid weight gain are signs that reflect organ rejection post-kidney rule transplant, 0-1 rule. Actually, let me do that again. This has to be. I'm going to do this question again. Play from cards. Okay. So are we ready for the correct answer? It is this. When a person receives a kidney transplant, the immune system sees it as foreign and attempts to reject it. Hypertension, elevated body temperature, swelling hands and feet, decreased urine output, and a rapid weight gain are signs that reflect an organ rejection post-kidney transplant. So number 1, number 3, number 4, number 5, and number 7 are correct. And with this particular question, you get partial credit. So that means that every option that you got correct, you would get 1 point. And the options that you got incorrect, you would not get any points for that. And they would not take away from your correct choices. Okay, so not only do you have to know that with the next generation NCLEX, you can get more items, they can be worth a specific amount, but you also have to know when your wrong answers will affect your overall score or if they won't affect the items that you got correct. So much to know. And the end, you need to be ready to pass NCLEX now or be prepared for next generation. And I absolutely think that right now is the best opportunity to take and pass NCLEX. Don't wait. If you are able to do it this year, then do it this year. I will show you how to prepare for your state boards and pass the NCLEX in the next 4 to 6 weeks or even less with the NCLEX virtual trainer. So let's get into our next study session. I am ready to help you get your nursing license, and we will talk about part 2 next Monday at 8 p.m. about how NCLEX is changing. Be ready to pass NCLEX now or be ready for the changes. Either way, guys, with God, you can, you will, you must pass NCLEX. It's possible. It is possible with God. See you later.